Good evening, everybody, and thank you for joining us this evening. My name is Joseph Fernandez Mode. I'm an assistant professor of surgery and a trauma surgeon. There we go. And a trauma surgeon at Duke University in North Carolina. I'm also a co-founder of the Latino Surgical Society and want to give a warm welcome and thank you for joining us today. Next slide. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event is in line with this mission. Next slide. We want to thank our institutional members who supported the LSS, but also the faculty and trainees at their institutions. If it wasn't for them, we really wouldn't be where we are today. One of our upcoming events is the LSS Surgical Symposium on Latino Health, taking place in Seattle, Washington on May 17th and 19th. Early bird registration is available until March 25th. And lastly, I want to thank all of you, our members, friends, and allies for supporting and believing in the Latino Surgical Society. If you have not yet done so, I'd like to encourage you to visit our website and become an official member today. And so getting on with the evening, tonight I welcome you to the third installment of our new series, where we highlight the experiences of residents who match into competitive fellowship programs. We hope that this event will offer our audience some wisdom and guidance that you can take into your own careers. Today's installment, we will talk with 3 future trauma surgeons and to begin, I have the pleasure of introducing our moderator for tonight, Dr. Nancy Lopez. Dr. Lopez is a third-year general surgery resident at the NYU Langone, Long Island, Long Island, pursuing a career in trauma and critical care. Nancy.
Thank you, sir. Thank you, Dr. Fernandez, for that lovely introduction, as well as introducing Latino Surgical Society. And to begin with our events, I'm going to go forward and introduce our panelists for tonight. Our first panelist is Dr. Eva Fuentes. Dr. Fuentes, she was born in Mexico City. She grew up and completed medical school at the Universidad Nacional Autónoma de México. After graduating, she decided to pursue a surgical career in the U.S. She first immigrated to Boston, Massachusetts. Here, she completed numerous research projects on surgical oncology, as well as trauma and critical care at Massachusetts General Hospital. After 1.5 years of being an avid researcher, she was able to pursue her goal of becoming a surgeon. She matched into a preliminary position at MGH, where she successfully completed her intern year and subsequently transitioned to a categorical position at Florida Atlantic University. During her clinical training, she developed an interest in endocrine surgery, and she decided to continue her research efforts, traveling back to Boston to complete 2 years of research at Dr. Paringi's laboratory. Her research efforts were mainly in developing a new cell lineage to study a form of thyroid cancer. After completing her stay in Boston, she traveled back to Florida to complete her last 2 years of clinical training. However, the trauma seed that had already been planted during her early years in Boston flourished, and she decided to switch gears and pursue a career in trauma critical care, for which she did her fellowship and is currently completing her fellowship at UMass Bay State Medical Center in Springfield, Massachusetts. Thank you very much for joining us today. Our second panelist is Dr. Patricia Martinez. Dr. Martinez, she's a second-year fellow in traumatology, surgical critical care, and emergency surgery at the University of Pennsylvania. She completed her general surgery training at the Medical College of Georgia, and she obtained a doctorate in philosophy and biomedical sciences during her residency. She was born and raised in Puerto Rico and is a graduate of University of Puerto Rico School of Medicine. After her fellowship, she will join Duke University as an assistant professor in the Division of Trauma, Acute Critical Care Surgery. Her academic interests include basic science features in sepsis and trauma-induced systemic inflammatory response. She is a mom, a wife, and passionate about promoting work-life integration in academic surgery. Thank you for joining us today as well. Lastly, our third panelist is Dr. Adrian Colujo Centeno. He is currently a first-year trauma and acute care surgery fellow at Denver Health and the University of Colorado. He was born and raised in Venezuela, where he also went to medical school and graduated in 2011 from the University de Oriente. He did a postdoctorate research fellow in acute care surgery in Washington University in St. Louis, and he went to general surgery residency at the University of Texas Medical Branch in Galveston. Dr. Colujo will be joining Denver Health Medical Center and the University of Colorado as an assistant professor of surgery at the end of his fellowship in 2025. Thank you everyone for joining us today. Now we will proceed to the first set of questions for our webinar today. This is open to all the panelists. So first question, to begin, can each one of you share why you chose trauma critical care?
Okay, hi everyone. Thank you for the introduction. Well, I chose trauma critical care because I like one sentence, and I'll explain more a little bit, but because I like the fast pace, I like the variety of diseases and different pathologies you get to treat, both in trauma and critical care, as well as acute care surgery. As we mentioned, I was at some point interested in endocrine surgery, and that was what actually kind of pushed me away from pursuing that route, was that I would be treating one disease, 3 operations, and that would be it. So I just like being able to perform more different, treat more different pathologies.
I'll go next. Thank you for the introduction. And I apologize if I cut off. We're having horrible weather in Philadelphia. My internet went out, so I am on my cell phone. Hopefully everybody can hear me. But I chose, to me, it's a encompassing field. It includes not just trauma surgery, but it includes acute care or emergency surgery and critical care. And I'm drawn to the complexity and the variability of the patients. Not everyone is going to be critically ill. Not everybody is going to be truly either at the extreme of injury or end of life. But at the same time, it allows you that, as Dr. Fuentes mentioned, that fast-paced thinking. And truly you have an opportunity to affect somebody's life, whether it's the patient itself or the compassionate care that you might provide to the family as well.
Yeah, and thank you again for this opportunity. But for me, it was just everything started when I was in Venezuela. I actually wanted to be a urologist, and then in Venezuela, you have to do general surgery and then become a urologist. And then while I was in my first year of residency there, it was one of the busiest trauma centers in the country, and I really enjoyed the fast pace. It kind of like changes constantly in cases, and it was a really challenging situation on a daily basis. And I think that's one of the things that I enjoy. And then when I moved here, this is kind of like what I wanted to pursue. I love general surgery, just to operate on every part of the body, but I also enjoy the medical management of the ICU. So I think it's a good compromise where you get to like have some time off to like do critical care and manage your patients medically, but also like operate on them and own them all the way through the process of like ER, ICU, and the operating room. So it was a good compromise for me. Certainly, I really, really loved it.
Yeah, I would love to add to that, because that's something that drew me to it, and the idea that not only are you taking care of the sickest patients in the hospital, the ones that are really the closest to the physiologic extremes, but you also get to see them throughout the entire continuum of care, like you mentioned, from the emergency room to the OR to the ICU to the floor and beyond. One thing that hasn't been mentioned and that is really particular to myself is that I found that it was the ideal specialty to truly marry what I do in the lab and offer an opportunity for translation and scientific discovery in what I do clinically. I believe that if you find a way to marry those two things well, it really becomes quite fruitful, both for your patients, because you really get to push the envelope and open up new ideas and opportunities for their care, but also for opportunities in your lab and your science.
Yes, definitely concur. And thank you everyone for giving that information. And then kind of to transition a little bit to our second question, we somewhat discussed about it during the introductions in the bios, but regarding trauma and critical care and applications for our audience members, many of you had prior research experience and research interest. Do you feel that in the specialty that it's requirements for applications or in order to pursue trauma critical care? And if so, how so? And kind of another subset question, how do you feel your prior research experience helped you incorporate this into your current profession as a either current or future trauma surgeon?
Yes, so I guess I'll go first. So I did do a significant amount of research. Part of it was because as a foreign grad, it's kind of like the way to put your foot in the system and start building connections and, you know, getting letters and stuff like that. At least for surgery, you definitely need that. Whether you need it for trauma specifically, it's a little bit more debatable. I do think that it will not hurt you to do it. And if you want to get into a competitive trauma position, meaning the best programs in the country, you definitely do need it. How to incorporate it? If you want to just imagine any program, you probably are okay just as a general surgeon without research. That's my opinion. How do you put it in? How do you find time to do it? It depends. Some programs in the country offer a 2-year gap, like mine did, or 1-year gap where you can go do research. If not, then you can certainly do it during your training. I know in my program right now, there's one 4th-year resident that didn't take any time off, and she has as many publications as some people that took 2 years off. So if you really are passionate about it, you really want to do it, you can definitely find time to do it during your training. Doesn't have to be basic lab or basic science research. It can just be outcomes, can be clinical research that you can accommodate into like a general surgery residency life.
I agree, and I'm going to add to both what Dr. Fuentes and Dr. Fernandez mentioned, with the caveat that I did do a PhD residency that not a ton of people do, and I actually did not go into residency thinking I was going to do that. I trained at a program where dedicated research time, meaning research developmental years, were optional. My original plan was to do 1 year research, and then I fell in love with basic and translational science, and then ended up doing 3 years and completing a PhD during that time. That being said, I'm going to echo a lot of what has been previously said. You don't necessarily need to have academic involvement, meaning publications, presentations during your general surgery training. Most of the trauma surgeons, most of the emergency surgeons are out in the community. There's actually a few of us that will be staying fully academic. That being said, knowing how to read literature, knowing how to incorporate what's printed in the literature helps you advance your own practice and how you care for patients. And I think that's one of the biggest impacts of doing research during your training, is because then when you're reading the literature as part of your daily practice, whether it's your CME, evolving your clinical, and in this case, I'm talking about clinical practice, then you're able to tell what's good literature. Is this something that will help me change, or do I need to adapt my practice patterns and how I care for patients? As Dr. Fuentes mentioned, if you're interested in training in one of the well-recognized trauma, and whether you're thinking of a 1-year surgical critical care fellowship, which is something we can talk a little bit more, versus a 2-year that incorporates surgical critical care and trauma and emergency surgery, those programs will be looking for individuals that are interested in continuing a career in academic surgery and do have shown that they will not only participate in quote unquote research, whether it is basic science, translational, health services research, even educational, but have involved themselves in organizations such as Latino Surgical Society and other academic surgery. So I think although it's a big component, it's also one of the components that helps you become a well-rounded applicant, especially if you're looking for those most well-known programs.
Yeah, and I kind of echo a little bit what Dr. Fuentes and Dr. Martinez also said. I mean, in my case, my career was a little bit similar to Dr. Fuentes. I'm a foreign medical grad, so like doing research was kind of like the way of like building a curriculum, being able to apply and be able to get a position in an academic center for residency. But then after that, you know, I wanted to stay in academia after I was done, so I continued to do research while I was in residency. I didn't take time off. I just like did it while I was in my clinical years, which is possible. It was an option on my program to take time off too for research. I just didn't want to because I had already done some time prior. I think that for the application process, it certainly puts you in an advantage if you want to go for like the big names of in trauma acute care surgery, especially now with most places transitioning into 2-year programs and kind of like you're looking into those in those places. I would say that helps. I also have to say, like, if your job is or if your goal is just to become a trauma surgeon, I don't think research is required. And then one interesting factor that I saw at EASE in January when they were having the fellows and like residents workshop, it was very interesting because like there's such a diverse practice in trauma acute care surgery where like even the big academic centers, you can be there as an assistant professor of surgery or associate, and your research requirement is not that high. There are other people who do a lot of research, there are people who don't do research, and it's a very diverse practice. And I think that's what was one of the advantage of this field in terms of like what you want to focus on. I think research is, again, if you want to do it, do it. If it's something that you think is going to be beneficial for your application, for sure. But again, it's, in my opinion, I don't think it's required. I like it, and specifically the outcomes research, because I think I'm kind of like come up with ideas while I'm rounding. So that's how I usually brainstorm for my projects. But again, some of my colleagues don't like research at all, and they're still well positioned, and they're doing fellowships right now, and they're going to join. Some are going to private practice, some are going into academic practice despite not liking research. So again, there's plenty of opportunities.
Yeah, as an avid researcher myself, the reason why I have pursued it and continue to pursue it is for a lot of the things that have been mentioned. Number one, by being able to know how to critically evaluate the literature that other people are publishing, I can better treat my patients. I don't do HSR research. I don't really do outcomes research. The research that I do is translational and device development. To me, being able to participate in something that may help my patients get better, right, and understand and ask questions that will improve the care of my patients, even if it's within my own institution. Some will say that's quality work. Some will say it's research. I think all of it boils down to continuing to ask the questions that are going to improve your patient care. With respect to getting into the programs, yes, there's going to be programs that don't have stringent research requirements, but I will say, if there's any way to truly differentiate yourself from the pack and identify yourself and frankly give someone else in the room to talk to you about when you're on that interview process, research, publications, a study, and interest that's outside of operating, makes that a lot easier. And in truth, it gives the person on the other side of the table who may be interviewing you or considering you the impression and that you're interested in clinical work, but also improving that clinical work. You know, a lot of people that I meet, in particular fellows, right, that come through, they're like, I'm not interested in research. I don't want to do anything. And when I hear that, I'm just going to be honest, that means to me that you're not interested in making the patient care around you better. The reason why I say that is in order to make it better, it doesn't just come from you and your hands. You have to learn how to evaluate what you do and make sure what it is that you're doing is right and is making things better. The only way to do that is by doing the research. Call it what you will, right? But even if you go into a private practice and you go work at a for-profit hospital, there will be a infection committee, there will be a RVU committee, there will be a hospital length of stay committee, there will be an OR utilization committee. And what do you think all of those committees do when they are having their meetings? Is going over the data. Call it what you will, but the acquiring of data, the interpretation of data, and the utilization of data to improve patient care permeates every part of clinical care. It does not have to be understanding the mitochondrial respiration and activity of platelets in the clot, or in my case, developing devices, but understanding how to evaluate your performance and the performance of the people around you so that your patients get better care, and understanding how to do that, I think is very critical to differentiating yourself and being a great surgeon. The other thing I want to add is that just because you do, you know, and Dr. Fuentes is a perfect example of this. You know, you end up doing cancer research for several years, right? And then all of a sudden you change your mind and you want to do trauma. Yes, it would help if you did a paper, but if you don't, that doesn't matter. In my mind, it really doesn't. And I can tell you from speaking with a lot of other program directors and with people that are making the decisions, it doesn't. What it shows is that you have made a commitment to understand the scientific process of how to have an idea, create a hypothesis, study that hypothesis, interpret data, and do it for the purpose of making patient care better. That alone, whether it's in endocrine surgery, vascular surgery, neurosurgery, right? You know, there are HSR researchers in trauma that do TBI exclusively and work with neurosurgeons. That you don't have to delay what you're doing in trauma to pursue more research in it if you already have a portfolio of work that demonstrates your capability of coming up with an idea and publishing it.
No, I definitely agree with this conversation and all the kind of the key insights from everybody. I feel as residents, sometimes we just kind of think about applications in the sense of another checkbox, like things to make us a competitive applicant. But I think sometimes we forget that we learn so much about research and how to critically analyze data and how to apply that for our patients and even our communities. So I'm glad that we were able to discuss the importance of this and how it translates to not just our current application process, but also to overall patient care. So I definitely appreciate everyone's comments. And kind of going on that path regarding a strong application, going to our next question, what other kind of tips or pieces of advice do you have to further strengthen your application for trauma and critical care specifically?
So I can talk for my personal experience being a foreign grad. I don't know how much of the audience might have that similar situation, but research as a foreign grad was, I think, what made me a strong applicant. The ABSITE scores matter, but they don't matter as much as they've made me believe during residency. I don't want to, with that, I don't mean that you shouldn't care and you should fail, obviously, but you should always, try to do as best as you can. Other things is that your letters of recommendation. I think you definitely want to get the letters of the people that are going to write you a strong letter, not so much focusing on the name of who's writing the letter. What I want to say with this is it's better if you, like in my case, if you get a very strong letter from a faculty that is just a faculty, doesn't have a big name in the academic world, versus getting a letter from a big academic person, even in the Harvard system, that might not say many things about you because they didn't get to know you well. From talking to my current program director, that's what that's what he put a lot of weight on, was my letters of recommendation, and those of the stronger ones being the most important ones, not so much the name. And like Dr. Fernandez said, I think you want to be that person that is reminded that is remembered, sorry, by the interviewer or by the program director as someone different or special. So you want to have something that you're good at, that you're interested in, that's other than just operating, because we're all interested in that. We all love the OR, we all want to be great doctors, but you have to have something extra. And it doesn't always have to be medical or academic. It can just be, I don't know, a sport that you're very good at, or an instrument that you play, those things that make you unique and make you be remembered by whoever interviews you, because that shows that you're committed to something, not only surgery. And that is really important from what I've heard from other, from my program director and other program directors.
I agree. I think this goes back to the point of becoming a well-rounded applicant. And I think it's quote unquote like the match, right? The programs are looking for a certain applicant and you're looking for a certain type of program. So I think first defining what it is that you want out of fellowship and what type of program you want to train at will then help you decide like what needs to be those checklist items. What are those buckets that I need to fill as an applicant? And they can look very, very different. If you're considering going to a
Oh, I apologize. I think it's raining at her current location, so she's having some difficulty. Oh, you're here.
yeah, I did the caveat I might get kicked out multiple times. Are you able?
Oh, she's currently fighting with the rain on her side of town. I'll give her a few seconds. She isn't able to log back in. We could speak with Dr. Golulu in the interim.
Yeah, absolutely. So, for me, I think the application process, you have to look at it the same way, second what Dr. Martinez and Dr. Fuentes said, like, it's your application, it's your presentation to a program. So in my opinion, everything matters, everything has a weight, like, I think if you have good like research and good publications, or a number of publications, that obviously adds to your pool. Your upside scores are, though it is true, I don't think they are like the most important thing. If they are good scores, it will show that this person can pass boards, this person is going to be fine. Like, I don't have to teach this person the basics of general surgery versus somebody who may have very low upside scores, and then on top of that, I would say, your letters of recommendation, very important. I agree, they don't have to be like my application. If I'm honest with you, I only have one trauma surgeon writing me a letter. The other three writers were a surgical oncologist, a pediatric surgeon, and a thoracic surgeon. But I work very closely with them. They were mentors, and they wrote me very strong letters. And those were things that were like highlighted when I was in the interviews. Like, oh, your letters, are good letters. And so, like, at no point I thought that by not having a trauma surgeon writing me a letter that was going to be a weakness. I felt like as long as these people can attest that I'm a good resident, I'm a good doctor, and everything, that speaks favorably. So that's all important. I think, when you're presenting yourself to a program, they're opening a file. If what they're seeing is good, then obviously they're going to be more interested. And I think once you make it to the fellowship interview, they're just looking for a personality, like, that you match with the vibe of the program. At least that's how I feel. And this is kind of like what we're looking right now, even with the current applicants that are going through the process in our program. So those are things to think about. I think that once you interview, you'll notice how different every program is. And that was one of the biggest shocks for me. Like, you're going an idea of like, this is the kind of practice I want to have. And then you interview in place A that you thought you wanted to go. And it's like, oh, well, absolutely not, because like, this is actually not my style. And so, you got to define early, if your intent is to be like a lot of like very operative trauma, then you got to look for that. Like, surprisingly, obviously, even though there are 2 years, they're double AST verified and everything, some of these places like are not trauma heavy, they're more emergency general surgery heavy. Their critical care training is stronger than their trauma. So you have to like know some of those things that you will also learn during the process of interviewing. And in terms of the academic aspect, like the same, to keep in the same conversation of the doing research or not. Some places are strong academic centers that they're going to encourage you to do research. They expect you to do research. And some other ones are like, they're training you to go into practice and, immediately right away. So those are it's a very diverse field. And for me, that was one of the most shocking things during the interview process, to learn how different every program was. And then at the end, you kind of sit down and your pros, cons list, and then come up with a program that you like. It doesn't necessarily need to be the program that you thought was going to be when you started the process.
I'm
I
gonna
think
jump
it's all.
in.
Go ahead. Oh, there you go. Go
I
ahead.
don't know where I cut off. I might get kicked out again with this weather, but I really want to echo what Adrian was mentioning, that the diversity in programs and the diversity in the training that you're going to obtain depending where you go. So that's why knowing what your strengths and weaknesses are as far as your training. Did you train at a program that was highly penetrating trauma? You didn't see a lot of blunt trauma. Therefore, the operative experience that you would like to have is blunt trauma versus vice versa. You trained in a highly blunt trauma mechanism institution, you want to obtain some penetrating trauma. So what are the gaps that you want to fill or areas that you want to further develop? Is there a specific academic interest that you are looking for? Is there someone at an institution that could serve as your mentor or as your sponsor if you're interested in continuing a career in academic surgery? Do you have an interest in advocacy? Is that an institution that promotes advocacy? Does it have an injury violence prevention program? How strong is it? Because you're interested in outreach. Or is it an institution that's known for being forthcoming with guidelines because you're interested in the education component? So what defines you as an applicant and what are your interests becomes your elevator pitch. And then you use that to then match to the program that you're interested in training at. And hopefully, as everybody has mentioned before, those things that help define or differentiate yourself from the applicant pool are also highlighted in your personal statement and are also highlighted in your letters of recommendation. Because very different from when you were going through general surgery residency application, trauma it's a lot more of you're interviewing the program, the program is interviewing you, because these people will truly become your mentors and your sponsors for the rest of your career. You have a lot more things in common because of the specialty of interest, because of your academic interest, and the broader population that you trained with during your residency. So truly, quote unquote, to use the term holistics, but like truly use that holistic approach to evaluating the program and then you as a candidate, because they will be doing the same.
That is great advice. That is great advice. If I can add to that, you want to be thoughtful in your decisions of where you apply. And that's a very generalized statement, but what I mean by that is if you're selecting 1-year programs and your intent is to develop operative skills in penetrating trauma, and you go and say that to them, I would personally look at that as someone who did not think about the program that they were interviewing at. Everybody is going to get critical care and you're going to get 10 months of it. And there are going to be elements in that critical care that are very good at some places and elements that are very good at others. At our own institution, one thing that I find that's very unique is the ECMO experience. And there is a very, very broad-based ECMO experience and in taking care of those patients. If you go down to UT Houston, you're going to get a very intense trauma experience. If you go to New Jersey, you are going to get a more well-rounded experience in a 1-year program that also offers an operative experience. Memphis is another. But if you're looking to do critical care and have an opportunity to gain experience in the specific nuances of acute care surgery, right, which include emergency general surgery and trauma, within that realm, there are also big differences. Having trained at Penn, I went there with a very specific mission. I wanted to learn how to take care of penetrating injury patients, and I wanted to grow my ability to perform clinical research, which is one of the hallmarks of that institution, is the clinical work that they do in the penetrating injury environment. I had trained for my residency in Texas, and so I took care of a lot of blunt trauma. I am an avid trauma surgeon. That's what I like to take care of most. But there are other programs that are very emergency general surgery heavy. And if that is where you foresee yourself being in terms of your practice, okay, now is the time to be selecting the thing that is going to prepare you best for where you want to be. And that decision comes from within you. You know, a lot of us are, progress through residency and just want to get to the next place and go to the next place, and not necessarily thinking about what we want our optimal career environment to look like. Okay. Do you want to go work at a place where they see 12,000 people a year? Okay. And you are doing trauma and ICU, and that's it. Or do you want to go to a place that is more emergency general surgery heavy and almost no trauma? Those worlds all exist. And so thinking about what is the best for you, and then selecting those programs that are going to best prepare you to get to that place, is what I mean by being thoughtful. Okay. The other element that I wanted to touch on just briefly is 1 year versus 2 year. Understanding that there are limitations within the 1 year of what that program can offer you. And so if you want to do a 1 year program because you think you got enough operative experience in your residency, which is very fair for a lot of people to say, you want to be able to select a place that is going to complement what you have already learned to make the experience most fruitful for you and offer you something more than what you already have. Okay. I would say that makes you the best well-rounded candidate for a position after you graduate. Remember that you're going to be looking for a real job after this. And in the world of trauma surgery and critical care, okay, when you look on that job board, they're not as frequent as one would think, right? The spots are being filled, and oftentimes spots need to be made for people in order to accommodate them if they want to go to North Carolina, or if they want to go to Houston, or if they want to go to Philadelphia or New York or LA. Because otherwise, unless Arkansas is really where you want to go, or Minnesota or Montana to work at a small level 3 or a level 2, or just do critical care and emergency general surgery, that is what you really need to start defining for yourself. I have a friend of mine who's going to be taking the chief position down at Baylor at St. Luke's. And at St. Luke's, it's emergency general surgery and critical care. He wants to take trauma call. So for him, he had to negotiate in order to take trauma call at Ben Taub. But if you want to take a job at St. Luke's, that's something you need to talk to them about. You have to be able to handle the trauma that comes through Ben Taub, but also have a mainstay practice in emergency general surgery and critical care. So when you're thinking about the programs, be thoughtful about it. Don't just select based on name. Okay. A lot of people do that. Is like, oh, well, I went to this place and they gave me the best training, right? But and I'm not saying anybody on this call is a marginal candidate, but if you're finding yourself in a position, okay, where you don't have everything that you might need, okay, first of all, have someone else tell that to you. Don't tell that to yourself, because often we're far too critical of ourselves. Number two, be selective about where you are going, okay? And about where you're going to go and interview, and put that time in. Another thing that I wanted to add to the letters of recommendation piece is, yes, it is absolutely true that having letters of recommendation that demonstrate that you are a hard worker, that you are a thoughtful person, that you are in the top 5% of the people that they have worked with, is super important. I think if you're going to pursue a career in critical care and you're going to want to do trauma surgery, emergency general surgery, critical care, You need at least one letter from someone who says that you have demonstrated an extreme interest and a dedication to this as a profession, who can vouch for all of the things that everybody else is going to say. The more of those letters you get, okay, so long as they're authentic and honest, the better. And if you don't have one of those, seek one out. I think that's important. That shows the initiative that you have gone forward and said, okay, I need to demonstrate this to someone. And a good way of doing that is coming to them with an idea and saying, hey, I would love to study this with you. It looks like you do this in the ICU. That was really great. I would like to write a small paper with you on that. And maybe we can work together, so you can show them something outside of what you do clinically to demonstrate your passion and dedication to processes. And if you don't know how to find that person, email me. I know plenty of people around the country that are always looking for help in that realm.
Thank you, everyone, for all those lovely comments and input on the questions from above. I have, and kind of in that same sense, in that trajectory, I wanted to ask another question, but I'm also using this opportunity to let the audience member know that if you have any other questions, feel free to put it in the Q&A box, and we'll go over them as well. But kind of what was spoken about before regarding the interview process in the last couple of minutes, I wanted to hear your insight regarding kind of what you wish you learned about the interview process, or when you knew about it before having undergone it, or now kind of looking back, things that you wish you would have thought of before having those interviews. I know we kind of mentioned a lot of things already, but anything else that kind of that you could recall at this time in order to help our audience members as kind of interview season starts beginning in the next upcoming months?
So I think I would have liked to hear the same. I would have liked to have done a better job at differentiating these different trajectories that you're possibly going to have. You know, do I want to be just ACS? Do I want to be ACS ICU, or do I want to be just trauma ICU, or do I want to be everything? You know, and it's also hard, I think, for some of us to know what you want to do when you're finishing residency, because you might just love all of them, or you might want to just do two of them, and then you might be discouraged by people around you telling you that those jobs don't exist, that they're very hard to find, or things like that. But I think having in mind and being very honest with yourself as to what you want to do, and then looking for the program that is going to kind of help you fill those gaps that you might have, as we mentioned earlier, is something that I wish I would have done better before interviewing, versus interviewing and applying very broadly, and then interviewing at places that I then realized that I was either not interested in because they wouldn't fill any of these gaps, or I didn't even know that the gaps were there that needed to be filled, if that makes any sense. So I guess what I'm trying to say is being more insightful as to what you want and how you're going to accomplish it, versus just applying everywhere and, like you said, just trying to get it done and over with, and another checkbox in your pathway, and just moving on to the next level. Having a more thoughtful application would have been better for me. At the end, it worked out, but I would have saved money, I would have saved time and effort. And that's definitely what I think. Just thinking of things the way Dr. Fernandez just mentioned it is the right approach, and I did not do it that way. And so it's not that I regret it. It didn't have any harmful outcomes for me, but like I said, I would have saved time and effort and energy.
I echo that sentiment. I think if I could narrow it down in one statement, is ask a lot of questions. Ask questions with the faculty that you meet about their expectations of fellows. Ask questions from the program directors that you meet about their expectations of fellows, what their vision and mission is, because for each institution and each program, it will vary greatly. Ask a lot of questions. If you get to meet, and some institutions will have you meet with some of the mid-level providers. Most of them will have you meet with the current fellows. Get to know what the culture of that institution is, because in reality, most of the interviews are still happening virtual. It's very difficult to be able to ascertain one program from the other if you've never physically been in the institution, if you've never physically met anyone from that institution. And then if you're interested in academics, look at the publications from the faculty that you're going to meet. What are their interests? Are they very narrow? Are they very broad? And then lastly, like when you speak with the fellows or with the faculties, ask where are your fellows who are graduating going to? Are they going into academics? Are they going into private practice? Are they going into quote unquote the trifecta jobs, trauma, acute care, and critical care surgery? Or are they more critical care focused? Are they more emergency general surgery focused? Because that will help you get a flavor of what that institution is actually going to train you for, because that's what their fellows are graduating, with that skill set to then go out in the world to do. Because as Dr. Fuentes,
I think her Wi-Fi is also intermittently coming in and out. And
Again, I can just go and fill in between. But I would say that I wish I had known how different the programs were. I wish I had known how, the diversity in programs when I applied. I knew going into the application process that trauma was the biggest focus of my career. And so I guess to me, that made it easier when I was interviewing in some places, and even in the middle of the application when I was doing even research on places that I had applied, and I was like, well, I don't think this is going to be a good fit. So I will like email the programs and, say like decline the interview, or they will send an email decline it, just because like I didn't want them to waste their time and give someone else the opportunity to be in that interview. But I think that I wish I had known that. My advice is just, do your research about the programs. And once you interview there, kind of like feel free to email the fellows and ask questions. We're going to be honest with you. We're going to tell you the things how they are. If you feel that any red flags or any things that you're not like sure about, just again, feel free to reach out and clarify those things. I think that's the most important part. And I think, even through the process, you kind of like learn things about yourself when you're interviewing certain places that kind of like, they kind of fit things that you thought you wanted, but then not. So like, I think it's a whole experience. The interview process, again, for me was very eye-opening. So I wish I had known that it was like how diverse it was. But in reality, like the program I trained, we were very heavy in emergency general surgery, but like our trauma experience, we were a level 1 trauma center, but it was a lot of blunt trauma. And so I knew what I wanted to get was more penetrating trauma. And I knew that I wanted to, improve that skill set and do more like vascular reconstructions and go to a place that the trauma surgeons were doing their own vascular or their own thoracic. So those were like goals that I had. So I looked for places that were like that. And then, but again, even during the application process, and now that I'm a fellow, my perspective has changed in a few things in terms of like, I thought I wanted to like be in a huge university hospital, and I decided to stay in a county hospital just because it fits kind of like the style of practice that I want now versus like what I thought I wanted. And so it's a constant evolution of things that you feel like you like when you go into the process, and then what it ends up turning into. And at the same time, as long as you know what your weak spots are in training that you can improve during fellowship, I think that's probably a good way to go. And then during the process, you kind of learn a lot more about the programs and make a final decision. And again, it doesn't necessarily need to be a name thing. It's just a program that you fit, that you feel that you're a fit, but that you're also gonna get what you're looking for during your training. I think that's my biggest thing. I wish I had known that the programs were so different.
I think this is all really amazing advice. One of the things that I wrote down as I was thinking about this question is, do your homework. And what does doing your homework mean, right? Asking questions. That's what Doctora Patricia Martinez Quinones was saying. What I had here, if you don't know the answer, right? Because we've laid out a lot of things, and is reach out, ask people, okay? Don't internalize and think, well, I should know this by now, and I don't. Trauma, critical care, EGS is its own kind of unique beast. And one of the reasons why I really like it, and I didn't mention this earlier, is because of the variety of job opportunities that allow you to craft a professional environment that suits you almost perfectly. Meaning, if you really like academics, you can find it. If you really like trauma academics or trauma surgery in a private setting that has high volume, you can find it. If you like critical care EGS, you can find it. If you want a job where you're operatively heavy early in life and then get to do the thinking of an ICU later in life and transition into a more med surge type of environment, but continue working and taking care of patient care, you have it. If you want to, work with residents at most institutions that I have ever trained or worked at, the service lines that have the most contact with the residents and that have the most time with the residents and interaction and opportunity for autonomy is in trauma and EGS. And I'd love to, before I continue, see if anybody else with thumbs up or thumbs down is that, what your experience was. Because I think that is also, a really important thing to think about. When you, this is more of a practical thing, when you get to the interviews, and I say that for one, because I know everybody here is going to get one. When you get there, again, do your homework. You will get a list of interviewers. If they don't, and I was super neurotic about this, and maybe I am super neurotic, I learned about everything that those people did. So if they didn't want to talk to me about what I was doing, I had something to talk to them about what they were doing. There's nothing more that most people in the world like doing than talking about themselves. And the way to engage them in a conversation is to learn about them, right? I was meeting people that I had never met in my entire life. Learn about them. Ask them questions about what they do. That tells them that you have taken the time to take interest in them, and they will then take interest in you, right? We get so introspective about this whole process and like, it's me, and I got to like, and you get in there and all you want to do is talk about yourself. They have your CV. What they want to know outside that CV and all the stuff that you have written down in your application, they will ask you. Now is the time to ask more questions of them. Not in a way like you're on a first date and you're like trying to nitpick with them, but you have taken the time to read a paper they wrote. If they're not writing papers and they are the trauma medical director and they are doing something unique in the trauma medical director position, like at Penn, figuring out how to do police drop-offs in a city where there's high crime, ask them about that. That shows that you have gotten engaged in the process and that you are not sort of passively going through, but rather are interacting with the process. That tells me as the interviewer that you care, that you're a thoughtful person, right? Because at the end of the day, we want to work with people that are thoughtful, that are interested, that want to work with us. You could be the next Michael DeBakey, but if you are an arrogant ass, I don't want to work with you. I would prefer to work with someone who wants to come to work every day and train hard and learn than someone who thinks that they already know everything. Because you can't teach someone something if they think they already know it. And if they're coming from some place that they think they have already learned it all. And as one of those people, right, having been in Houston, Texas, Newark, New Jersey, Philadelphia, and now here, I can tell you that all three of those locations are very different from each other. The personalities are all very different from each other. The expectations are all very different from each other. And so doing your homework to understand what the personalities of those programs, what the expectation of the program, what you should be expecting from the program is very important. And I'll take also a step back as we keep talking about program. This is going to be 1 to 2 years of your life. Okay. Understand that 1 to 2 years of your life, particularly if you have a family, can be a long time. And it can be a long time if you're doing it in a place that you hate. Okay. Take this opportunity to go meet people that you haven't met before who are going to shake the hands of the person who's going to hire you for 3 to 5 years. I want to repeat that. You are going to make relationships with people, okay, who are going to shake the hands of the person who's going to hire you. It's no longer after this, oh, I'm going to go into the match and I absolve myself. It is a passive process. No, you then have to go out there and start hustling for a job that is going to pay you and keep the lights on at your house. So you got to realize that the impression you make during that 1 to 2 years is critical to you getting a job, because just as you trained, for example, at shock trauma, and Tom Scalea himself is going to write you a glowing letter, and then you go to some other spot and you don't put in your effort, and it is in complete contrast to what Scalea said, okay? That is going to be a problem when you are trying to find a job, because they're going to ask the last person that you worked with what your behavior was, what your passion was, and what your skill level and your dedication to the process is, you know? And that job, again, is also going to be looking for a normal person that is going to bring something that that place may not have. And I know that we're over time, but I want to stress this, because for so long in medicine, you know, it is this passive process where you put you're active in what you're doing and getting these grades, but then the selection process is sort of like you surrender to the machine, and then the machine just goes and, like, with some weird algorithm, picks where you go. Okay. To a certain degree, the fellowship match is similar, but when you get out of that, this is not how it is anymore. You have to go out there and send your CV out, go and meet people, see programs, make sure that that part of the country is where you want to live for a while. Okay. Because most people will stay at programs for 7 years. Like, that's the average before someone starts bouncing around. Most contracts are for 3. Okay. So thinking about the regionalization also of where you go and train for your fellowship is going to help where you go and live after that. Because if you want to go live in Miami, okay, and you trained, you know, somewhere in Arkansas that doesn't know anybody in Miami, that's going to be a more difficult transition than if you went and worked at Ryder. Okay. And, you know, likewise in North Carolina, which I have to advertise because it's a wonderful and beautiful place to live. If you want to come and work here, it helps if you come and work here and train here. But getting beyond that, knowing where those contact points are, and again, doing your homework about that becomes really critical, because you're not just applying for another year. You are applying for a job to go be a teacher in some of the 2-year programs, an instructor where you're admitting patients on your own, to then get that real job, which is dependent upon the places that you've trained, the performance at all of them, the regionalization of the program that you work, the skill level of the things that you worked at. And if working at shock trauma or, you know, UT Houston or Ben Taub or Grady is what your passion is, then you have to ensure that you've done the work to go train and have trauma operative skills, because that is what you're going to be doing for the majority of your time there. You know, I had Tom Scalea tell me personally that he primarily looks at people from 2-year programs because they've had the ability to develop their chops in the operating room under some form of more guided supervision. You know, I've also gone and seen other places, people that have trained at UT Houston, gone outside to a 1-year program to return back at UT Houston. And similarly in New Jersey. But if it's going and to a very specific place because you're couples matching, or you are committed there because of another family, you know, for family, you have to be very thoughtful about how you are doing that process. And so do your homework, be thoughtful, be authentic. Okay. And if you have questions that need to be answered, all right, ask them, and feel free to email me. And I'm sure some of the panelists wouldn't mind some emails to answer questions about their own programs and the ones that they are familiar with. If you need to know more about the specifics of the personalities of the programs and what they offer.
I'm going to check one more time to see if Dr. Martinez was able to join us once again. But I don't.
Her internet access is dead, so she will not be. But she says, thank you for the opportunity and that it was a really great webinar.
Well, thank you, everyone. I know we're coming up on time, and I value everyone's time and patience. But I think from today's session, we definitely had fruitful conversations regarding overall the trauma surgeries and then regarding everyone's interests, as well as how to be a good applicant and not just focus on trauma itself, but how to be an overall good doctor and care for your patients, which I think ultimately is our goal. Regardless of what specialty we go in, whether it be trauma, critical care, or another subset. But thank you, everyone, for your comments and guidance. And I wanted to use the last minute or so to see if anyone has any last minute comments or like a one-liner if you would like to provide for our audience members before we have final remarks. Okay, but thank you, everyone, for joining us today. Regarding contact information, if you go back to the link for which you registered on this event, I believe there should be a Latino Surgical Society email that you can reach out to, and we could see how best to disseminate the panelists' contact information if you have any other further questions. But overall, thank you for joining us today for the third installments of the Suing Success, which is a series to highlight various fellowship programs in surgery. And thank you once again to honorable panelists for your information and guidance for today. And if anyone else is interested in learning more about trauma or Latino Surgical Society as a whole and organization, you could find us at our email address, which is latinosurgicalsociety.org, and various social media channels. And this webinar specifically will also be available on the YouTube channel in the next day or so. So keep an eye out for that as well. Okay. Thank you, everyone, and have a great evening.
Thank you.
Thank you.